Good evening and welcome to this year's Women at Heart. I'm Jocelyn Mementa, thrilled to be with you this evening and to be your host. We are live from the fourth floor of Hartford Healthcare St. Vincent's Medical Center. We have a wonderful show for you this evening, including an interview with two of our cardiologists here at St. Vincent's and a heart-healthy cooking demonstration by Chef Raquel Rivera of A Pinch of Salt, along with registered dietitian Melissa Keeney. The pandemic has certainly changed our lives this past year, and we would have loved to have celebrated with you in person, but we are thrilled to be with you virtually and extremely grateful for your support tonight. Before we begin, just a little bit of housekeeping here. The silent auction will remain open until 9 p.m. It actually started 2 days ago, so some folks have a bit of a head start. We do want you to bid and bid often. Winners, you will be notified by email and will have the opportunity to pay online within the bidding site. So look for that, or by check at the foundation office. Details will be sent to your email address. It's the same email address you used to register for the auction. To get us started, please welcome Vice President of Philanthropy, Diane Auger. Diane?
Thank you, Jocelyn. Good evening, everybody. This event started in 2012, and since that time has raised more than $750,000. The reason that we have the Women at Heart event every year is so that we can educate women in our community who are underinsured or uninsured about heart disease, which is the #1 killer of women in this country. That cause became even more personal to my family and to me in 2017. In April of 2017, my husband received a phone call on a Monday morning that his oldest sister, Beth, had passed away suddenly. Beth was 59. And 1 week later, that next Monday, he received a second phone call that his youngest sister, Kathy, had passed away suddenly at the age of 51. So in 1 week's time, he lost 2 of his 4 sisters, both because of heart disease, undiagnosed heart disease, complications. And so if you're out there and you're watching and you're a woman, put yourself first, take care of yourself. Let us help you to be sure that you understand all about heart disease. And you're gonna hear so much about that tonight. So we hope that we educate you tonight and hope that you help us educate women in our community to prevent heart disease. We pull off a virtual event not alone, with a big village of people. There's a lot of people in this room that made it happen. There's 3 special people who helped to lead our committee. Those people are Laura Flavel, who serves as the regional director of our medical staff office here at St. Vincent's, and 2 of our talented cardiologists. We have lots of talented cardiologists here. 2 of them who helped lead this event are Dr. Anya Wagner, who you will meet tonight, and Dr. Jeffrey Berman, who we also meet in another minute or so. I'd also like to thank Chris Howard, who's a member of our philanthropy staff and leads our special events, who makes all the magic happen for our events. And then I'd like to thank some signature sponsors. You help us to make it happen. Lots of sponsors help us make it happen. We've got a few signature sponsors that we want to thank tonight. Jennifer Amadio, thank you so much, a very consistent and longtime supporter of our Women at Heart event. Bill and Gloria Paul, I hope you got online and you could watch this tonight. Thank you so much for your support. Brad Evans, thank you so much for your consistent support as well. And some of the companies that support us, Aquarian Water Company, Local Union 488, thank you, Dan, and the Cardiology Associates of Fairfield County, of which Drs. Wagner and Berman are associated as well, so thank you. So now it gives me great pleasure to introduce Dr. Jeffrey Berman. Jeff serves as chair of cardiology here at St. Vincent's. He also has a passion for prevention and wellness around heart disease, and he's going to tell you the story of a very special sponsor when he comes up to the podium. Jeff?
Thank you, Diane. And I also wanted to thank the Chris Howard and the committee. I had a list of people to thank as well, but Diane thank them all, so I'll forgo the list. We canceled this event last year because of the pandemic, and it feels a little strange to be doing it this way. We're used to doing it in a live event with a lot of people, a lot of buzz, and but I'm very happy that we're able to do it this way, and I really am grateful for everyone who helped organize it and for all of you who are watching us tonight and participating. Thanks to the generosity of one sponsor, the Daddario family, who created many years ago the Irma Daddario Memorial Hypertension Endowment Fund, we have a very special gift to all of our virtual attendees this evening. In the past, we gave away a swag bag at the end of the evening, had good things in it like little Tito's vodka and things like that. But this year we have a gift that's, I believe, much, much more valuable. I'm going to step over here and just show what the gift is. It's this Omron blood pressure cuff. This is the top of the line cuff, and it is their Omron 7 series. It's Bluetooth enabled, a blood pressure cuff, and that was paid for by the Daddario Fund. And you can choose to get one by going to auction item number 200 on the auction page and selecting it. There is no cost to you at all. And more important than the cuffs that we're giving away to all of the people who are here tonight, we're also have a program to give away cuffs where they're needed within the community. So we're distributing them to our patients in the primary care practices and to the patients in our cardiology practices. And in addition, we are going to be giving them out to patients who need them after they're treated at St. Vincent's and through cardiac rehab. And finally, through the parish nurse program and some of our food pantry programs that the hospital sponsors, we're going to be giving them to individuals who could benefit from them out in the community. So we're really grateful to the Daddario family for their generosity in making this gift possible. And I'm also asking each of you who decide to get one or not to feel free to make a donation to try to continue to grow this fund within our institution so that we can distribute even more blood pressure cuffs to people who need them. So hypertension or high blood pressure is a major risk factor for cardiovascular disease. It's probably the major risk factor worldwide, and controlling blood pressure can make a huge impact in controlling, in reducing the impact of cardiovascular disease and stroke throughout the world. So in checking your blood pressure at home actually has been shown to be probably better than checking it in the office. A lot of people have white coat hypertension, and the blood pressure that we measure in the office is often artificially elevated. So monitoring your own blood pressure at home is a very useful thing. So I encourage everyone to take advantage of this opportunity. It's a very simple thing to do to check one's blood pressure. It's very automated. The cuff comes with instructions as well. So now I'd like to turn our attention to two of our nurses from our office, Lisa and Sue, who are going to share information about other risk factors as well. Thank you.
Hi, I'm Sue, and this is Lisa, and we're both nurses in the cardiology practice of Hartford Healthcare. Heart disease is the #1 killer of women in the United States. There are some risk factors for heart disease you can't control, such as your age or family history, but there are other risk factors that you can control, such as smoking, exercise, maintaining a healthy diet, plus controlling your cholesterol and diabetes. Find ways to reduce stress and live a healthy lifestyle.
Our physicians can evaluate the risk for heart disease and provide education on how to limit risk factors. Put more life in your life and call for an appointment today. We have offices in Stamford, Norwalk, Fairfield, Trumbull, Bridgeport, Stratford, and Milford.
We should all know our risk factors, and I want to thank our nurses for highlighting some of those risk factors specific for women. We are extremely fortunate here at St. Vincent's Medical Center to have a strong leadership team. And that team is led by Vince DiBattista, Senior Vice President, Hartford Healthcare, and President, Fairfield Region. Please join me in welcoming Vince DiBattista. Vince, it's great to have you with us. Thank you for joining us.
Thank you, Jocelyn. I was told that this is a live event, and given the hour, we're a perfect lead into the NFL draft tonight. So for all of you long-suffering Jet fans, this is one more opportunity to get it right. So I want to start by thanking everyone for their continued support of St. Vincent's Medical Center. These past 12 months have not been easy for any of us, both personally and professionally. Hartford Healthcare is proud to be leading the state in administering vaccinations with nearly 400,000 doses to date, with 177,000 residents fully inoculated. When we began our affiliation with Hartford Healthcare, our goal was to make a difference in the delivery of healthcare in Fairfield County and noticeably improve access, quality, and the patient care experience. I am proud to say we have made great strides during this past year in creating local access and new clinical programs, along with recruiting over 200 new providers to the market. We've expanded our outreach with ambulatory services in Stamford, Wilton, Westport, and Milford. Our institute model is also making a difference in the way care is being delivered. As I prepared for this presentation, I was startled about the facts I uncovered about women and heart disease. Although heart disease is sometimes considered a men's disease, in fact, almost as many women as men in this country die of heart disease. It is the most common cause of death among women, killing more women in all forms of cancer combined. Notwithstanding, there still exists a disturbing gap in knowledge, understanding, and general awareness. According to national studies, women are underdiagnosed and undertreated for heart disease. Our Women at Heart fundraiser is an opportunity to drive awareness of the disease and advocate on behalf of all women in Fairfield County. It is also important for us as a healthcare institution to remedy the lower rate of detection for women of color and lesser economic means. This is a challenging disease for women. Many experience heart disease symptoms prior to diagnosis that often are ignored. So what is St. Vincent's Medical Center role in providing a solution for this growing problem? First of all, as part of the Hartford Healthcare Heart and Vascular Institute, we offer comprehensive heart care in multiple locations, not only in Fairfield County, but throughout the state of Connecticut. Our experts will help you navigate and schedule follow-up appointments closer to home to ensure consistency of care. We offer a wide depth of clinical expertise, offering advanced, innovative treatment in the latest techniques. We perform minimally invasive procedures in a variety of heart problems, which means safer, faster, and easier recoveries. With our affiliation with the Heart and Vascular Institute, we are part of Connecticut's leading provider of care for cardiovascular services. We take pride in the way our team provides heart care that is personal, professional, and comprehensive. This evening, you will have the opportunity to learn what you can do to prevent and overcome this potentially fatal disease. Here to share some of the signs and symptoms of heart disease specific to women are a few of our dedicated cardiology nurses.
Hi, my name is Rose. I'm from St. Vincent Emergency Department. Heart disease kills more women than all cancer combined. Don't be alarmed. Just be aware that women experience heart disease differently than men. Women tend to experience burning pain in the chest, pain in the back, jaw, or shoulder, an upset stomach, lightheadedness, unusual tiredness, or anxiety. Don't wait to talk to your doctor about risk factors and know when to call 911. The St. Vincent Emergency Department will be here for you.
Be sure to call 911. As I told you earlier, the auction, silent auction, will remain open until 9 o'clock, but I do want to give you an update on some of the items. We do not have bids for number 42, which is Family Fun. These are gift certificates to local activities. That's a great item to get for your family, especially this time of the year coming in. And as you know, our restrictions are easing now, so be sure to take a look at that for Family Fun. Number 49 also does not have a bid. And this is the New York Knicks John Starks signed jersey. For those of you who are sports fans, this would be a fun gift to give or get, actually, as well. So again, that silent auction will remain open until 9 o'clock. Bid and bid off it. It's great for a great cause. As I told you earlier, we have Chef Raquel Rivera from A Pinch of Salt to share a heart-healthy recipe tonight. Well, here she is with St. Vincent's registered dietitian, Melissa Keeney. They're making roasted salmon and cannellini beans with tomatoes, sage, and rosemary. And they're sharing nutritional information as well as tips for a heart-healthy diet.
Hi, my name is Melissa Keeney and I'm the registered dietitian here at the Spine Wellness Center. Welcome to our demonstration kitchen. Today we're going to be cooking a heart-healthy recipe. I'm here with Chef Raquel Rivera.
Thanks, Melissa. So today what we're making is roasted salmon and a stewed or braised cannellini beans with tomatoes and some fresh herbs. So I'm gonna start with the salmon. I'm going to add some olive oil, but I just want something that the salt and pepper is actually gonna adhere to. You can brush it on if you wanted to. I'm just gonna take my hands and just rub it over it. And then I'm gonna salt. And then I'm going to add some black pepper. If you like, you can use white pepper or you can omit the pepper. You don't have to even add it. And that is it.
So the serving size is 3.5 ounces, but a quick reference, it's just a little more than the size of the palm of your hand.
Gotcha. So this is gonna go into the oven. 12 to 15 minutes, depends on the thickness of the fish. It doesn't have to be 100% cooked through. It can be a little opaque in the middle. So I'm going to start the cannellini beans. I'm adding about a tablespoon of oil. I'm using a nonstick pan, and I'm gonna get my shallots in. You wanna just dice them up. And then I'm adding herbs. I kind of just break it and add it right in, and add some sage, and just bruise it. We're gonna cook this down a little bit, so I'm gonna increase my heat now that I'm fully focused here. I'm going to add in those diced herbs and garlic. Now, garlic only takes about 30 seconds to actually cook, but you wanna infuse it, so that's what we want. So I'm just giving it a nice little mix and allowing it to come together. You should be smelling something. I smell something.
It smells great.
You know? And then I'm gonna push this over, and I'm gonna get my tomatoes in, might as well.
Could you do another type of protein besides the salmon?
So yeah, a nice chicken breast would go nicely with, you know, and still keeping it a healthy meal, you know?
Right, yeah.
I mean, it's really nice to kind of use whatever you have on hand. Talking of which, these beans are going in.
In terms of heart health, rinsing off the beans gets rid of a lot of the sodium. So if you're watching the salt, that's a good way to make this recipe a little lower sodium.
That is exactly right. So anyway, I'm getting this in, and here we have some stock, okay? So again, either you can buy unsalted or you want to buy low sodium. So it's really cool to even make your own, and it's simple. It's really simple to do. So this is going to do its thing. I have fish to go look at. He looks happy. All right, so salmon is out.
So in terms of recommendations for fish, I get this question a lot. How often should I eat fish? The American Heart Association recommends in terms of heart health that you should eat fish twice a week. And that would be oily fish like salmon, tuna, sardines.
Kind of what we did today.
Yeah, exactly.
All right, and we have our salmon. Serve myself, I can't wait to try it. We're gonna eat now.
I can't wait. So in terms of nutrition, I mean, this meal is really nutritional powerhouse, right? We have the fish, which has omega-3s, which is good for heart health. We have the beans, which have protein and fiber. They're really a superfood, right? We have some vegetables. We flavored it without much salt. Well, thank you so much, Raquel. This was delicious.
Thank you. If you have any questions, feel free to reach out to me on Instagram. It's a Pinch of Salt Cooking. And, definitely tweak it, make it your own, and have a good time doing it, because I sure did.
Yeah, and you can find me on Facebook at Melissa Keeney, Registered Dietitian, and I would love to see your pictures or your tweaks to the recipe, or if you have any questions about nutrition. And thank you so much for joining us, and have a great night.
Hi, I'm Kim Yakovone from the St. Vincent's Cardiology Lab. We have state-of-the-art technology to treat a wide range of heart problems, including heart rhythm disorders, stents for heart blockages, and valve replacements. This means minimally invasive procedures that reduce the risk for complications. When needed, we also work closely with our anesthesiologist to ensure that your procedure is safe and comfortable. And best of all, most of our patients go home the very same day.
The recipe that Raquel shared with us is my kind of recipe: simple, delicious, and healthy. One of our dedicated committee members is Kit Shapiro. She's the owner of West of Westport, and Kit is the daughter of actress and singer Eartha Kitt. She designs jewelry inspired by her late mother's heart and wisdom. And tonight we have available for you to purchase a necklace featuring Eartha's hand-drawn heart with the message, "Here's to life," engraved on the back. Let's take a look at it. I'm thinking that you are probably getting a close-up look of this necklace. This is a lovely piece that you can purchase for yourself or give it as a gift for a loved one. And of course, remember, Mother's Day is next Sunday, so this would be a great gift as well. We hope you are enjoying our educational videos being shared by some of the nurses here at St. Vincent's Medical Center. Our physicians and nurses are the heart of the organization, and we are blessed to have so many compassionate care providers here at St. Vincent's. Now, meet a survivor who benefited from this exceptional care she received at St. Vincent's, and she wanted to share her journey. Here's Diana Berry.
My name's Diana Berry. I was a heart patient at St. Vincent's Hospital in November 2019. I went off to what I felt was a routine doctor's appointment. I had woken up in the morning and done 45 minutes on a treadmill. I'd recently started Weight Watchers to lose some weight and felt like I needed to exercise every morning. So the 45 minutes of the treadmill was with an additional baby aspirin to get on without the pain that I was feeling. So when I got to the doctor's, he did an EKG, Dr. Sean Nigerian from Griffin Health Facility, and kind of felt like something was different about it. He explained to me that we could handle this two ways. I could go home and call a specialist at a later date, or I could let him call me an ambulance. And I looked at him and kind of said, "An ambulance?" And he goes, "Yeah." And so I said, "Why?" And so he said, "I want somebody to check your heart out, a specialist. So you determine where you want to go and we'll send you there." So I told him I wanted to go to St. V's, and I called my daughter, and she had said that it was Thanksgiving tomorrow, so she had just put a turkey in. And if I was going to have another test, that she would come after that second test was done to give them time to evaluate me. So off I went by myself. And as I'm in the ambulance, we're kind of going at a normal speed. Things are, we're just going at a normal speed. All of a sudden, the lights go on and we start going quicker. When I got to the ER, I met Dr. Edward Carrera, who is a physician here at St. V's. And he explained that he had looked at an old EKG from January, and there were significant changes in it. He felt that I needed to go to the cath lab, and I needed to go now. So he called my husband. My husband was en route. Dr. Carrera called him again and said, "I can't wait for you." So as they wheeled me down this hallway, they're moving faster and faster, and I'm thinking, this is no joke now. And I still don't really grasp that I had a heart attack. I lost significant weight. I'm 70 pounds less than what I was when I started. I exercise like a fiend thanks to my rehab nurses, Sue and Kristen and Kelsey here. I could not have done it without all of them, without a collective unit of everybody around me. I hear people say that women should have breast checks every year, and I know I have friends that have breast cancer. I know how important that is, but I also know that you have to take care of your heart. I wasn't ready to say goodbye to Elias and Everett, my grandchildren. I needed more time with them. I feel I still need more time. I'm young, I have things I want to do, and I want to be here for them. So the things that I learned here, the things that I learned, thank you to Dr. Carrera, and thank you to the nurses, thank you to my work ethic, thank you for eating healthy, and hopefully somebody's going to hear something and say, oh, maybe I should go to a doctor. We've ran into people along the way that say that. At the things that we've spoken at in the past, you'd be surprised how many women say, I'm going to call the doctor on Monday. Well, good, call the doctor and go see him. If you save one person from any pain or one family from losing a family member way too soon, then you feel that you've accomplished something.
Thank you, Diane Berry, for sharing your story. I'm sure you made a difference in someone's life tonight. We want to welcome back Dr. Jeff Berman, and he's joined by another one of our top cardiologists, Dr. Anya Wagner. It's great to have you both here.
Thanks, Jesse.
We just heard from Diane Berry. She said she didn't even know she was having a heart attack. Dr. Wagner, is this typical, and what causes a heart attack?
Actually, it is very common that people are not even aware that they have a heart attack. And actually, it was just a study published last month showing that only 44% of all women are aware that cardiovascular disease is the #1 killer. The other problem is that women very often present with more vague symptoms. They can have chest pain, chest pressure, but very often they just feel tired, shortness of breath, or indigestion. And that's why it's very often missed or delayed.
So women have different symptoms compared to men.
Mm-hmm.
Dr. Berman, are women less likely to miss the warning signs, or more likely to miss the warning signs, rather, of a heart attack?
I think that is the case, Jocelyn, largely because, as Dr. Wagner said, the perception is that heart disease happens less frequently. So both men and women will often say, oh, that's just a little indigestion or something else. They'll blow off some vague symptoms or even not so vague symptoms. We all practice denial, but because women expect to have heart disease less frequently, they're more likely to do that. So oftentimes they do present later after the start of symptoms. And with a heart attack, the quicker you get to the hospital, the quicker you get that artery opened up, the better that you do.
Dr. Wagner, you mentioned that symptoms are different for women. Why is it that we have different symptoms?
I don't think that is clearly known. But it is just very common that women delay to seek help, but also women are used to be the caretaker and not taking themselves as important. So there's so many factors that.
That's why it's important for them to know the symptoms.
Yes.
So they can identify that and hopefully save their own life.
Yeah.
Dr. Berman, is the impact more serious in women compared to men? Because they do delay?
Well, if anyone does delay, it does cause a bigger heart attack. And there is some data that mortality is higher in women after a heart attack, a little bit higher. And again, I think it is because of that delay that often occurs. So whenever anyone thinks they may be having a heart attack, it's important to get treatment right away.
Exactly. Call 911
Call
first
911.
of all, right?
Don't drive yourself.
Exactly. We just heard that tonight. Dr. Wagner, are the risk factors for a woman different than a man's?
So the traditional risk factors apply for men and women: high blood pressure, high cholesterol, lifestyle, so a lack of exercise, poor diet, diabetes. But then there are women-specific risk factors like postmenopausal state, history of breast cancer treatment, or autoimmune diseases like rheumatoid arthritis, which are much more common in women.
And that's why it's really important that we also need to know our risk factors, Dr. Berman.
That's right. No, it's very important to know the risk factors. There's, in addition to knowing your blood pressure, and I hope everyone signs up for their blood pressure cuff, item 200 in the auction block. But in addition to blood pressure, there are other numbers that one should know, including diabetes, hemoglobin A1C, your BMI, and cholesterol numbers. And then finally, one thing we've talked about before is to know the calcium score is a number that's not talked about as frequently because it does involve getting a very simple CAT scan, but the data shows that single number, the calcium score, is probably the best predictor of one's cardiac risk. It takes all the risk factors combined and shows what's happened in your body at this point in time. Do you or do you not have any evidence of heart artery disease?
So what's involved in a calcium score?
Calcium score is a very quick, simple CAT scan. You don't need an IV or anything. You just go to the hospital or the radiology office. It takes, and you lay on the CAT scan machine. It takes about 5 minutes, and you get your calcium score. Mine was 31. It had been 0 10 years earlier, so that's still a decent score, but it's high enough that I know I have a little bit of plaque, so I had to put myself on a statin.
Dr. Wagner, have you gotten a calcium score?
Yes, and mine is 0.
Yeah.
Yours is 0. Okay, I too have undergone calcium score. I have a 3, which I guess is also very good. So based on your score, that's what you look at to determine the treatment for it. Is that right?
Yeah, so if one has a score of 0, which I did when I was Dr. Wagner's age, then the risk of an event, a cardiac event, within the next 10 years is very low. And once you get up above 200 or so, then the risk goes much higher. And we see patients who have scores over 1,000. I think our record so far is a little over 7,000. And if you have a high score, then that means you have to be much more aggressive about treating blood pressure, treating cholesterol, treating diabetes, exercising more. You have to really double down. And sometimes you need more advanced testing, like a stress test or even a cardiac catheterization to know what is going on.
What other heart screenings are there that you would recommend?
That also really depends if a patient has symptoms or not. If you have, so just for risk stratification, the calcium score is excellent, particularly for somebody who has a family history of heart diseases but no symptoms. If you have symptoms, and it really depends on the characteristics and the severity, your cardiologist got to decide if you need a stress test or an ultrasound of your heart or just a heart catheterization. So it really depends on the presentation.
What's your message tonight?
I think it's really to know your numbers and to take care of yourself. And they're actually, the American Heart Association came out with Life Simple 7, that if there are 3 medical things. You want to treat your blood pressure, diabetes, and cholesterol, and 4 lifestyle things that we can all do, and that's eat well, maintain a good weight, don't smoke, and exercise regularly. And if you hit all 7, it decreases your risk of heart disease by over 90%. So it's largely a lifestyle disease. There's a lot that an individual can do to control their risk. So that's would be my message tonight.
Do you want to add anything to that, Dr. Wagner?
And seek treatment. You know your body. If something is wrong, see a cardiologist.
Thank you both for being here. Both of you make such a huge impact in the lives of patients in our community, so thank you.
Thank you.
Of course, we couldn't do it without the support of families like the Daddario family, who chose to honor the memory of their parents with an endowment to support the critical work being done through St. Vincent's Cardiology Department. So be sure to get your free blood pressure cuff. Just go to the auction page, and I think Dr. Berman told you it's item number 200. Staying heart healthy is indeed important. How your diet and exercise can play a huge role. Listen to this.
Hi, my name's Kristen and this is Kelsey. We work for the Cardiac Rehab Department here at St. Vincent's Medical Center. Cardiac Rehab is a 12-week monitored exercise program that will help you recover from a recent heart event or cardiac surgery.
Did you know that patients who participate in 36 visits of cardiac rehab have a 47% lower risk of death and a 31% lower risk of suffering for a future heart attack?
Being monitored helps you rebuild the confidence that you need in a safe atmosphere and will also help you design an exercise program moving forward.
In addition to our exercise program, we also offer an education program to help patients better understand exercise, their medications, nutrition, risk factors, as well as stress management. Talk to your doctor today to see if cardiac rehab would be a good option for you.
Thank you for being with us tonight as we wrap up our event. Mother's Day is next Sunday, and there's still plenty of time to grab a terrific Mother's Day gift. Let's take a look at this. This is a pair of 14-karat yellow gold teardrop earrings from our friends at AJ Klein in Shelton. Beautiful, right? Got to get this for somebody you love. And we also have a gift card from City Line Florist in Trumbull. If you've ever seen any of their beautiful floral arrangements, you need to get this card because it's well worth it. Again, it's a gift card from City Line Florist in Trumbull. They've been great supporters for this event. A reminder to all of you, the auction will close at 9 o'clock. Again, go in and check things out. I believe there are still some items with no bids. We are grateful to all those who donated and to our wonderful committee who worked so hard to put this event together. We could not have done it without them. And to all of you who participated in our silent auction this evening, all the proceeds, just want to remind you, all the proceeds raised will support women in our community with preventative screenings, equipment, and programs to support a heart-healthy lifestyle. Thank you all for joining us. Have a wonderful evening. We hope to see you again here next year. Don't forget, silent auction closes at 9. Get in there and bid.